I think we can start the session. If not, it streams. I am having the entire record. It's going to be an entire recorded video, and we can later upload and then share with people who missed it. I'll share the link with all of you as well. Thank you all for joining this webinar. It's also a first of. It's the first time I'm hosting a webinar by myself, and we have a very good panel of people and also attendees. So we already have now 57 people attending this live streaming as we speak. So like we discussed, the idea is to talk about, right now I see we are at the crossroads of the corona in this country. I mean, we're not sure if we are going to flatten the curve, or, are we in the way of flattening the curve because we're not doing enough experiments. But, with the kind of population density we have, I think we're in a considerably reasonable shape than many other countries in the world, which we should be a little happy about maybe. Also, what's next for India in this entire, scenario? So that's what I really wanted to have a conversation. And also the reason for picking up this panel would be, I wanted to have most of the stakeholders in place. Like we have, a policy maker and a young politician, a second-time MP, RammohanNaidu, joining from Srikakulam. We have Rakesh Garu from Hyderabad, founder of Factly, and also Factly is a public data mining place, and also which does a lot of fact checking on a lot of things which we see, which is also very important in these kind of times because information is everything in these crucial times. And then we have Shweta, a journalist now with The Logical Indian. And digital media plays much more crucial role in this period of time because, that's where the live information comes. We receive a lot of information, we receive a lot of problems, and they are kind of a people's mouthpiece to governments, to NGOs, to understand, what's happening across. So I thought this should be a good panel to talk about, what each stakeholder should be doing and what this country should be, thinking about in the next few weeks or few months to come. To start off with this, I think the first question I would like to ask is, today we all saw Modi ji's speech at 10. He addressed the nation, and we saw that the lockdown is going to extend for another, till May 3rd. How many of us really think the extension is important, and also how do we justify this extension? Because it's been like 21 days lockdown, and we actually think we have got the curve in shape to an extent, but also we haven't been doing enough steps. The question I have right now is, while we are extending the lockdown, one, if it's a good step or not. Two, what should we be doing in this extension of lockdown? Because what should be the next steps of the government in this next 2-3 weeks? If somebody wants to take the question and start with.
Yeah, I think I'll start with this. Thank you, Shravan, first of all, for organizing this webinar. Likewise, it's our first time also, and I'm very glad to see the other panelists also joining this discussion. And like you said, the whole reason that we are discussing today, or we are having a debate, is because of the coronavirus, COVID-19. And there is no vaccine for that. And right from the World Health Organization to every eminent academicist or scientist, everyone has been proposing that one of the main reasons to contain this virus is to maintain social distancing. So that has been the priority in the fight against this. And how do you do it in a country like India? You have to do social distancing at a mass scale is through lockdown itself. So lockdown is a very justified move. And initially what Modi ji, our Prime Minister, has done, I think everyone agrees with it. And we agreed with that situation, and we kind of followed with it in observing how it will go in 3 weeks. And seeing the position right now, we have seen that the number of cases have also been increasing. So definitely some of the reports have also been indicating that in India, the patients might peak in the month of June if these measures are not properly done. So kind of in the wake, and we have seen all the Prime Minister has also had meetings with various stakeholders, politically or economically, from various sectors in the economy, and everyone has suggested for extending of the lockdown. So definitely, I think there is an imminent need for the extension, because the only way you can contain this virus is through social distancing, since you don't have any medicine or vaccine. So that is one reason. But why we have to discuss the lockdown itself is because some of the challenges it is posing. So the first priority is containment. First priority is the disease itself. And for that, lockdown is definitely important, and the extension is also important. But maybe through the discussion, we'll also discuss about some of the challenges this lockdown has been throwing at the people, mainly the poor or the downtrodden. So that those issues are something, since we are doing it for the second time, there are a lot of issues which we can learn from the first time and take necessary steps so that we don't repeat on some of the mistakes that happened earlier.
Yeah.
Yeah. Thanks, Ravan. Like Ram Garu said, yeah, thanks for giving us this opportunity. I would like to touch upon 2-3 aspects of this. One, almost all of us agree that there is no escaping from this virus. It's the pandemic. Hopefully, we got a less virulent strain, or our inherent immunity or malaria, whatever theories are being discussed, is going to come help us. But there's no hiding that, there's no debating that point. One, today or tomorrow, the virus, we'll all get the virus, but it's a question of immunity. Now, given that scenario, we have to look at both the 21-day lockdown or the extension of the lockdown in this context. Now, frankly speaking, yes, most countries, even the worst hit, both the worst hit as well as countries which were not really hit that much, all of them went for a lockdown, varying measures. Some of them went for a total lockdown, some of them did not go for a total lockdown, but almost all the countries across the world have gone this route. Now, we need to understand that this is a very passive way of addressing the issue. When I say passive way, I mean, lockdown is something that people at large have to, society at large has to execute, implement. Now, then what is the active way of arresting this pandemic? The active way has to come from the government. So while people are responsible, in charge of ensuring that the lockdown gives its results, at the same time the government has to focus on multiple things. One, like you were referring. So we started with very, very, very little testing, and I think by yesterday, the latest figures that ICMR gave yesterday, we are at around 2.2 lakh samples. So we tested around 2.2 lakh samples, and the positive ratio, which started at around 1.5% in mid-March, is now around 4 to 5%. Now, I think the governments, I think they use the 21 days to, set up special hospitals, ensure that we have enough stocks of PPEs, all the equipment, medicines, etc. But these 19 days, this extension of 19 days, have to be used to essentially identify zones, contain them, do very, very aggressive testing, and ensure that you have an idea of where the virus is going to take us. So by the end of May 3rd, I would hope, the government is able to tell us, okay, this is where we see, we might have so many lakh people infected, but, this is our plan, etc., etc. So while lockdown is the passive way, I would like the government to use these 19 days productively. Both the central and the state government should work in tandem and ensure all these containment zones, the zones that they've identified, do very aggressive random testing. Even in, let's say, almost 40% of the districts have not recorded a single case. Like Ram was saying, Srikakulam and Vijayanagaram don't have a single case. So aggressive testing needs to be done to even understand the extent this virus has gone in terms of, what kind of infection are we seeing in 2 months from now, 3 months from now, so that we are all prepared.
Okay.
Yes. So Shravan, whether lockdown is good or not, that's redundant. It is the need of the hour. If you look at how the last 21 days have been, also remember, before I get to how 21 days have been, it's also important to point out that lockdown is a circuit breaker. It is not a solution to the problem, as Rakesh pointed out. What we're trying to do is we're trying not to burden our healthcare workers, and we're also trying to ensure that even though the virus is going to spread, we are going to put a full stop to the speed at which it's going to spread, ensuring social distancing. Now, if you look at the last 21 days, and we were expecting some very aggressive measures, and India saw harshest of lockdowns as compared to anywhere in the world. And perhaps that helped us to contain the number, the rapid rising figure. But even then, the total number has crossed over 10,000 right now. If you believe the ICMR data or the health ministry data, The data suggests that if there were to be no lockdown, we would have crossed over 8 lakh figure already. So we have, in a sense, contained that figure with the help of a lockdown. But when the Prime Minister was announcing that the lockdown, the new lockdown, a fresh lockdown is going to be put in place, we were expecting some sort of measures and also, a report card of what they have done so far. So only announcement that I heard today from the Prime Minister was that a certain number of hospitals have been set up, a certain 1 lakh beds have been reserved, but there was no sort of sense on where we are at the end of these 21 days. So that would have been nice. It would have been nice for the Prime Minister to give us some idea of where we are, and also going ahead, while a date has been set up of April 20th when lockdown could be phased out, given if it doesn't spread to other places and in certain areas, in certain zones. It's also important that we, cater to the need of the poorest to poor in the country, because we haven't had a plan so far. Even though we've announced an economic package, we haven't had a plan so far to cater to that 2 crore people in India who are migrant workers, laborers, stranded in different places. And it would have been nice for the Prime Minister and for the government of India to announce some sort of package. So yes, lockdown is important because the number continues to rise rapidly. It is rising rapidly. Various chief ministers and various ministers, policymakers are of the view that it must continue until we are able to flatten the curve. Remember, only Kerala so far and Goa perhaps is on the verge of flattening the curve. We are not doing too well in many other states, including particularly Maharashtra. So lockdown is important, and whether it's going to help us or not really depends on how people in this country are going to actively ensure social distancing. Having said that, I completely agree with Rakesh that it is passive way of looking at containing the spread of the pandemic. The active way is testing, and we have so far, I don't think we've even crossed 3 lakh testing so far. We're hovering around 2 lakh 20,000, some number that was put out by the ICMR yesterday. So we are not, actively testing. That could be because of various phenomena, as experts are pointing out. The protocol that India follows for testing is still very limited. And secondly, we do not have enough rapid testing kits. They were to come from, China. Some of them were to come to Tamil Nadu. They were diverted to the US. There's a consignment of 500,000 that India is still awaiting for. So perhaps those active measures would be nice to get rapid testing kits in place and ensure testing. That's what the WHO has been emphasizing on, and perhaps India has not been doing that enough.
Yes. So, which takes me to this question. I mean, did we really underestimate the entire effect Corona is going to have on India? Because the first case was repeated somewhere in January, and we have an entire month of February where the parliament was functioning, and Madhya Pradesh was happening. The entire government operating in Madhya Pradesh was happening, and there are a lot of other things which are happening across the country. There was no or minimal attention given to the entire case. And there was some central minister, I think the Minister for Health Center, came out and said, the virus will not, survive in these temperatures. If you stand in sun for 10 minutes, the virus will die. And there were many chief ministers. I mean, both Telugu states chief ministers said it's as simple as having a paracetamol tablet. So, did we really underestimate the effect Corona is going to have on us? One, and two, how did we suddenly? I mean, how did the sudden switch happen in the governments? From telling like this is not going to be a bigger impact to suddenly like an entire lockdown. I think we declared lockdown with 4 hours notice for the state country. So how do we see this? I mean, did we really underestimate, or was it calculated enough not to panic the people? Because we know if I give you a 2-day prayer information, there's going to be a lot of panic buying. There's going to be a lot of rush in the streets. So how do we see this? Is it a strategic move?
What I feel, because the parliament was also in session while this whole COVID situation was picking up all throughout the world. There seems to be a little bit of underestimation also in the beginning, whereas we were observing the world, and when you talked about COVID, at that time it was only about Wuhan or some cities in China, so it was very specific to a Chinese kind of problem, and until the WHO picked it up, the World Health Organization picked it up, and it was communicating information to all the countries across the world. I think we kind of took it a little bit lightly in the beginning, because we never had this kind of situation also. Had we had an example happening before, we would have understood that, okay, the seriousness of such an issue can be this much. But I think the initial underestimation goes back to the reason being China also downplayed it a little bit. China also said that it's a very containable disease. We are doing the best to look after this. So that kind of was sitting on the minds of a lot of people. But once we knew that it's going to be a dangerous scenario, there is no vaccine for this, I think India had the opportunity to do the lockdown or whatever strong measures it had to do a little bit earlier. But probably there were some scenarios, don't want to name them politically or don't want to sound a little bit pessimistic here, but some incidents happened which might have pushed the lockdown a little bit late. But had it happened earlier, had we contained the cross-border immigration that has been happening at that time, probably we would have had much lesser number of cases than what we have right now. But if you look back, it was late, but not. I mean, it was in a situation where we had to do that, and they did that. And once that thing happened, I think there were some. It was like a very impulsive reaction. More than I thought, there should have been some planning on closing down a country like India. If you're trying for a lockdown in such a country, it's just not putting law and order in place and ensuring that there is a proper lockdown. There were many challenges that the economy would face, that the normal general public would face. So those things, I think there should have been at least a prior some discussion with some of the important stakeholders at that point of time, and ensuring a proper smooth transition into the lockdown, which didn't happen. And I think we put the whole entire country into risk by going into lockdown also, compared to the COVID situation, because a lot of people were stranded outside. There were thousands of workers, migration labor was stranded, and so many people didn't know what to do. There was a panic that are we going to get the essential needs required for us? Do we have to hurry to the shops? And so there was the communication didn't happen. It was more like a sudden impulsive decision that we're going to go on a lockdown. And even today, the same thing has happened. I like what Shweta has mentioned, that there's no proper clear information coming out from the Prime Minister's address to the nation. He's just saying that, okay, there is an extension, there is dates and everything. But what is the plan? What exactly is the Prime Minister trying to communicate to these people? Was the 21-day a success? Was what the government trying to achieve? Did it happen, or were there any problems? Is there any other requirements that we need to do? And what is the plan for the next 15-20 days the lockdown is going to happen? So that kind of information should be there. And I think, again, we've come to that same scenario where there is a very minor information that is traveling to the public. And why I keep repeating this thing is because I think Rakesh would agree with what I say, because when the government is not clear on giving information, there is a lot of fake news that is generated. It gives a lot of scope for people to put in their own kind of information, or this is happening. Then you've seen all kinds, like if you say May 3rd, they count the dates, okay, 19 days, the moon cycle is so much, and this is happening, that is happening. So some irrelevant information, which is not necessarily important for this kind of situations, they all come into place. But when the government gives a clear-cut instructions, we are going for a lockdown for another 15 days because we have observed this, we have these reports, some of the scientists have predicted this, the World Health Organization has given us this. So those kind of information is also required, because people are waiting for content also. What I've seen is that the previous Prime Minister's address, it was more about COVID-19, what is the social distancing, or what are the initial measures in terms of health or staying safe, social distancing was required. But now people are looking for more answers. People are looking at, is there a stimulus package, or is my job security being taken care of, or if the farmer is there, what about my produce, or if there is a businessman, what about the future of my company? So people have moved on to questions rather than related to health. People have already understood the danger of the situation. They know what they have to do. They all came to the point that, okay, we are willing to agree to the point that lockdown is required for probably a month or so. But what about the economy? What about the future of it? And what about the other concerns? So that information is not coming from the government. So that is what is expected
today. Yeah, I kind of agree with most of what Ram said. I think a lot of countries in the world didn't anticipate the virus, to kind of have the kind of impact that it has now. Even I think the US is also guilty, and they're now, the consequences they're facing. Luckily for our country, I think we were in it a bit late, partly because I think our, global travel, etc., is compared to the European and Western countries were a little low, and fortunately, I think that has helped us. But even then, I think that we should have closed our international borders about 1 week before what we did. I think 1 week before March 22nd. I think a lot of initial transmission in the first 2-3 weeks happened through these travelers who came from abroad. So that should have saved the day. And secondly, I think, in terms of information flow, this is what we have been saying. I mean, the best antidote to misinformation is proactive information sharing. I mean, people can, float all kinds of conspiracy theories, but irrespective of how much distrust people have in governments and government functionaries, at the end of the day, what is spoken by government is taken as sacrosanct. At the end of the day, the government says X, yes, okay, X. So I think, especially in, since we are calling the entire breakdown of COVID-19 as an infodemic, not just a pandemic, that we are seeing the first information epidemic, it is very, very important for the governments to communicate the right thing. So I'll give you one example just to highlight this point. For instance, on the very first day when the Prime Minister asked people to observe Janata curfew and cap it off in the evening by thanking the frontline workers by clapping in your balconies, the very day when he made these statements, people started floating all kinds of theories saying, the virus lives only for 12 hours. So once we do Janata curfew on the 22nd, I think we have got rid of the virus in the country. That is one. And secondly, how clapping generates vibrations so that, the virus dies down. Now, nobody took this serious enough. Nobody within the government took this seriously enough and tried to actually tell people that, this is all fake misinformation. Please don't believe. And you can see the consequences. I mean, whatever we achieved in the morning of January 22nd, the Janata curfew day, in some places we saw people taking out rallies. When you ask them, they said, yeah, we received a message. We believe this is true. Because, the louder the sound, the greater the vibration, so the virus will die down. So it has a big lesson for governments, unless you should not allow others to take over information flows. So you have to ensure that information comes from you. See, obviously, for example, the Prime Minister doesn't, have enough time to lay down the entire guidelines. The guidelines may be 20 pages, 30 pages. What should ideally happen is the Prime Minister should have called for a press conference or whatever. I mean, we can call it a announcement where there are 15-20 people who are in charge of various things. Do a 2 or 3 hour long marathon press conference. Tell people each and everything that they're doing. Give them confidence. The Prime Minister can do his bit. His bit is confidence building, saying, we are in charge and there's nothing to worry. We are all in it together. That is the Prime Minister's bit. But it has to be followed by others speaking. We can't just have a scenario where, we just get these 10-15 minute bites once in a while, asking us to do things. And then suddenly you have documents and documents which are uploaded onto some government website. And we are at the mercy of those documents. That should not happen. I think proactive communication is the only way to deal with misinformation these days. And, in fact, we have tracked the flow of misinformation since the outbreak of COVID. So initially, during February, when it was confined to China, the misinformation was all focused on China. How are Chinese markets, how did this virus came about, etc. The moment it started getting into the European countries, US, and then to India in, let's say, mid-March or early March, we started seeing various kinds of misinformation. Could be about spread, all kinds of old videos. And especially the moment it came to India and Indians started taking this seriously, we had a host of misinformation around miracle cures. Now, I mean, our ancient wisdom has a lot of good things in it. They give us immunity. But, just to say that they give immunity, instead of saying they give us immunity, this is good to do, especially at a time like this. People are, just randomly floating all kinds of misinformation saying, you inhale hot steam, the coronavirus dies. So inhaling hot steam is good, but don't combine it with coronavirus. At the end of the day, there are a lot of people in this country who still don't engage with the formal healthcare system. There's a lot of us are used to home remedies, because, if I get a slight cold, I probably wouldn't see a doctor, unless it is serious 4 days from now. So it is very, very important from the government to nip it in the bud. I'm glad that, PAB started a fact check. Now, various governments, the government of Telangana, Karnataka, various governments are following suit. The only way we can, stop this or ensure people don't get into panic mode is proactive information sharing. That is the only antidote. You cannot leave it to middlemen, who become information brokers, and suddenly, it becomes that infodemic.
Right. So, coming to your question on whether we took measures on time or not, this was I remember it was wholly early in the middle of the March, somewhere on March 10th, and the lockdown came into effect from March 23rd onwards. So. Even during that time, and I clearly remember because we'd started doing initial articles on number of positive cases that were being reported from a few states in India. The numbers were in few hundreds. So obviously, we did not anticipate the kind of outbreak that we've seen now, and so the measures as and when they were taken were the harshest of measures. We imposed a nationwide lockdown because I think that's the best thing we could have done. We did not have enough primary healthcare centers, enough doctors. We did not have enough testing kits or even PPEs. So the best thing that we could have done is ensure a lockdown, and that's what we did. Now, the larger question here is whether the lockdown could have happened earlier. I don't think so. I think it started at a time when we were still in some few hundred cases, and that was the best time to ensure a measure which is so harsh to a point of a nationwide lockdown where economies and GDPs of states have taken a toll by 30 to 40%. So the timing was right. But coming to what Rakesh said about misinformation, and I'd like to bring in Tablighi Jamaat here because Tablighi Jamaat happened on March 13th. That was 10 days before the lockdown was announced and many, many days before an advisory was put into place by various governments, especially in Delhi. So when we saw that the lockdown was announced and, Nizamuddin came out to be a cluster of coronavirus cases, a lot of media, and especially the mainstream TV media of North India, went after a certain section of society. They continue to do so without even analyzing on what date did it happen, and was there an advisory in place, was there no advisory in place. It became sort of an agenda. Now, without really taking sides on whether the Jamaatis were right in conducting a congregation at that point in time, knowing that such an outbreak was happening nationwide, what essentially happened here is there was an absence of fact-checking mechanism, active fact-checking mechanism from the government side. That's when PIB jumped on board, and various other organizations which have been doing it already, including Factly and Alt News, took it upon themselves to bust the fake news, the onslaught of fake information that we saw, from live bat eating videos to people spitting on each other, etc. That continues to happen till date. And so I think the onus here lies with us, the media organizations, the independent fact checkers, to ensure that while we are in a lockdown-like situation, there is no, pandemic. The pandemic is on, but there's no absence of information or the right kind of information. So fact checking has to be done proactively, obviously, in order, and also people need to be told, the difference between what ICMR, WHO, Government of India is suggesting versus what your WhatsApp is telling you, and have a very clear picture, because it happens, I think, it's become so common now, but I keep saying that it happens, I think, in each of our families now, that our parents tell you, do this, have a lot of tea, it'll help you out, have a lot of water, take a hot water bath. So it's become so common that you're fighting it out every day, not just in public place, but also at your home with your own parents and your own family. So the onslaught of misinformation has found a new avenue, and that is the pandemic. We must ensure that there's a full stop to that also.
So now, speaking about so now the very crucial thing we all touched in our initial discussion also, the migrant labor. India has approximately, the census says, around 20 to 22 million interstate migrant labor, and around intrastate is around 80 million. So we saw what happened at the Noida and Delhi, and when the lockdown started, the amount of people were trying to move between borders. We saw between Andhra and Telangana, and I think Ram can also speak much about, because Srikakulam farmers he has been receiving a lot of messages from Gujarat, Maharashtra, Tamil Nadu, where thousands and thousands of fishermen have been stuck. So what is the way ahead for this? I understand, like, we can't let them into the states, or there's no mobility to move them. But my question or concern is also, is the government trying to address this issue? Putting them in a shelter and giving them food is one way of it, where none of them have any social distancing, or none of them have any other kind of facilities that we are having today. See, because the virus doesn't discriminate between if they are a migrant labor or a Taiwan Tier 2 city people, right? So is government really doing enough to support the migrant labor, or have they really had a task force, or some kind of a research or some kind of a way to how to make them move between the states once we ease in the lockdown at least. So is government heading in this direction or not is a question I have personally.
Well, considering, like you mentioned, in my constituency, there have been a lot of migration labor, especially the fishermen who go to all different kinds of ports across the country to work. And somewhere this situation was supposed to be addressed before the lockdown. At least there had to be a understanding that if the lockdown is happening immediately, then there would be a cross-country traveling of so many people, especially the migration labor. And I think that went for a toss. There was no proper planning on that side, because for at least a week we have seen people stranded on the roads itself. And I've seen people who have walked from Chennai to Srikakulam, which is almost like 2,000 kilometers, I suppose. So such long distances, people have been walking. So there was definitely the responsibility had to be taken by the central government, or if necessary from the state governments, but they were totally stuck in the implementation of the lockdown itself. So all the police, all the infrastructure, all the officials, they were all instructed to cut down the public which is coming onto the roads. But what about people who are stuck? And the railways was stopping their. It was all part of the lockdown. But this scenario was supposed to be addressed. I mean, at least had a go before the lockdown has happened. But once it came out, at least then the governments, especially the state governments, had a big responsibility, because they were the initial stakeholders in that. They should have given a confidence to those kind of people, especially through their contractors or through their employers, or establishing some kind of scenario where they were taken care of properly. See, if they were not allowed to travel to the place of their choice, at least they were supposed to make them comfortable at the place where they were staying. So they were supposed to offer them with lodging. They were supposed to offer them with food. But these basic necessities were also missing. And they are still missing today also. And I've been coordinating with some of the state governments, and I informed them that so-and-so people are stuck there. I talked to the officials. They are able to provide, but they're able to provide for 3 or 4 days. And it again comes to square one, where I have to call them again, or where they have to go through the whole procedure of contacting the government or some officials over there. So the scenario is still happening, and the challenge is still happening. I don't think the governments are doing enough. And it's a very challenging thing. I agree, it's not an easy task. It's not just a problem where you can just untie the knots. There has to be a proper action plan. There has to be a team which is sitting, especially on the migration labor in each state itself. And there is a central team which is coordinating how many people. I don't think even today, there is an approximate figure that so much number is under the migration workforce. But I don't think there is a proper worksheet made where how many number of people are stuck in each state, or what are the measures that is being taken. I think that is something which is still challenging, and the government should definitely focus on this. And this new lockdown, the lockdown 2, is also going to be a challenge for all these people who are stuck. And a lot of them were thinking, once this 21-day lockdown period is done, we are going to travel to our own places. So they've got whatever meager amount of money or food or ration, whatever they had, they were adjusting it to a 21-day period. And now the challenge starts to them again. And it's just not about food or this thing. It's about that physical confidence, the whole confidence that the government is with them, any other necessity. See, it's once the food is addressed, then there is the necessity of healthcare. If suppose any of these is facing some emergency situation, who do they go to? What do they do? And so all these different kinds of things are there. So so the problem of food and lodging, and then the problem of healthcare. So all these kind of issues, unless there is a specific team at the state government level, and which is trickling down to the local district level, some teams are operating at this. The problem of migration labor is very, very pathetic. I have to mention that it's very pathetic, and something the government has to do immediately. And I was hoping that the Prime Minister's address today would mention something about it. Should at least a directive to the state governments that there has to be an ensuring procedure for them to have 3 meals a day or proper lodging. But nothing of that sort has come. So unless the Prime Minister gives that kind of push to the state governments, I don't think that the priorities shift. again, the priorities become on people coming onto the road. We have to stop them, and all the infrastructure is put under that. But what about the challenges that we have seen through the 21 days? At least those kind of priorities should have been made in this new lockdown, which hasn't happened.
Yeah, I think it is clear that the governments didn't anticipate the kind of problems we would foresee, and especially in this country, we had one big disruption like the demonetization, which happened in 2016, where it was a major disruption to general life. So if we had learned any lessons in terms of how would people react to any situation, I think we should have been better prepared. So any situation that leads to panic, we know how people respond. Think of the middle class who have at least good enough money, access to everything. If they are rushing out and trying to buy rations, and obviously the migrant labor have nowhere to go. So when people are told that you will not have anything, your life will be shut from tomorrow, no food, no travel, and all that, I'm sure it leads to a panic situation that should have been anticipated. Or people who got this labor, I mean, whether it is contractors, realtors, they should have been told. I mean, one classic case of why good government policy does not actually result in execution, and we see what happens. These are the consequences. So we have this building and construction workers cess, which mandates that every realtor who constructs a building give 1% access to contribute to 1% cess to the building and the construction workers welfare board at the state level. Even as per 2018 figures, we're talking about 1 year, 1.5 years ago, more than 30,000 crores collected by welfare boards across the country, whereby states lie unspent. So we have around 3 and I think 3.2 crores registered by then. So if the real estate market is around 5 crore labor, we are talking about 60-65% of the people who are registered with these boards. So we know who they are. We know where do they stay. So when we have all that information, I think this was something the government should have anticipated. Okay, there will be migration of labor. The people will spill onto the roads. How do we tackle this? There was so much money. It was never a question of money. Money was there. It was all about planning well and all that. Coming back to even these 19, I mean, let us all agree that it is very difficult to hold people at home. I mean, we can extend the lockdown jolly well for 2 more months, but for it to work, people need to see, okay, there is light at the end of the tunnel. For instance, it's not switch on, switch off. Tomorrow, for instance, assume everything goes well and we'll lift the lockdown on May 4th. It is not as if life will go back to how it was on March 21st. It will take at least 3-4 months or even 6 months for everything to return back to a semblance of normalcy. And what we need to understand is give them a plan, give them confidence that apart from what the government is doing, giving confidence that we are tackling the virus, and for some reason we are able to address it better than most of the countries, but also tell them what is the action plan. I mean, on May 4th, can I assume a lot of entrepreneurs, for example, I myself am entrepreneur, I'm responsible for, let's say, come 1st May, responsible for 25-30 people. Now what kind of see, the government can go on giving orders saying you cannot cut wages, you cannot do that, you cannot do this, but when the government itself is deferring wages in most states, why will private establishments accept that if the government itself is deferring wages? So I think a plan is what needs to be told now to various sections. I mean, starting with the poorest of the poor, because they are the most hard hit. They hunger, these are most immediate needs. Of course, some parts of it have been taken care, where governments, I think, have given out monetary benefits, ration, etc. But we need a plan for every section. This is where I always go back to the proactive communication bit. You can't so for example, people keep on sending messages, almost 50, 100, 200 messages every day on our WhatsApp asking if this is true, all made of messages saying the government might do this after 20 days, government might do this after 15 days, things are going haywire, whatever. I mean, why should anybody believe in such crap? So if the governments are proactive telling people that this is happening, there is no reason why anybody should. And all the more that people are staying at home 24/7, they have nothing else to do but watch TV and news channels. So I think this is a wonderful opportunity for government, like they're showing some old super hit shows on Doordarshan and getting TRPs. I think this is the time for governments to proactively communicate with people. So unless that happens, we need a plan. I mean, the 90 days lockdown is fine. We have taken a decision. All of us, as citizens of this country, should support our governments. But with a rider that the government should come out with a plan. what will happen on May 4th? Will I be able to go to work? What will happen to my, to my future? Everybody, it could be anybody. So sector by sector, I think if there are solutions and plans, only then this whole thing is going to be successful. Else, you will see people spilling out onto roads, and it is very easy to create unrest in society, especially a diverse society like ours, where there are competing interests, where there are vested interests. It's very easy to create unrest. So the way to address all this is telling people, yes, we see the light, we know where the light is at the end of the tunnel. This is the plan. This is how we go about it.
Right. So, Shravan, one of the criticism of this government, the Modi government, has been is that there are a lot of announcements that we see year on year without a lot of groundwork. So while we see, the government making proactive announcements, the grounds are not laid firmly, and what happens resultantly is chaos. So there are approximately 120 million people in this country who travel to urban labor market every year, from rural India to urban India in search of work. Now, we saw images and heartbreaking images of people on streets, bags perched on their hands, children, kids, women walking for thousands and thousands of kilometers to their native home. And I fail to understand a government which is not just made out of politicians, and my apologies to Ram here, but we often think of politicians as people who are not very educated. Politicians who just sign on the paper. The background work is done by bureaucrats, and everything that is done is finally out there, is made by policymakers who consist of the most educated people in this country, go through a very rigorous process. I fail to understand how is it that the Indian bureaucracy could not anticipate that people would want to go back to their hometowns. If you shut down every factory that is operating, if you shut down every construction activity, if you ensure that people are not going to get any wages from tomorrow onward, you are going to expect them to go back to their native land with the money they have in order to ensure their survival. So I think it's a very big failure of the Modi government, wherein it cannot anticipate the after effects of its various very, very big announcements, right from demonetization to a rollout of the GST that was done in a haphazard manner, and now the lockdown that was announced. What is, I think, very saddening is that when the second lockdown has been announced today, I still see no measures being announced for the rural people. Urban middle class are still at home. The only problems that they're perhaps facing is the shortage of grocery and expensive items. But the rural class, daily wage earners, what about them? How are they going to earn money? They can't earn money, and who's going to provide them with food, shelter, mobile connection? Now, we know when that sort of Anand Vihar and all these areas where people started gathering in large numbers on the national highways that connect Delhi to UP to Bihar. So when people started moving out, there was a panic and a chaos and also a confusing state, because state governments did not know what to do. They had opened their borders temporarily. Thousands and thousands of people were on the borders. They wanted to cross, so the police had to let them go. And when the central government finally put out an order that no, whoever, wherever they are, stay put, and the state governments are supposed to look after you, that's when the state governments finally took the onus. Until then, they were only taking care about their own people. They didn't think much about the migrant laborers. So that happened, and then we know the Supreme Court intervened, and the Supreme Court gave a diktat to the central government, to various states, saying that take care of your migrant workers, give them shelter, give them food, ensure they're put in quarantine, do not let them wander, do not let them be hungry. But it's absolutely distasteful, the kind of pictures that were out. It's heartbreaking because the national media covered it, international media covered it. It brought a lot of spotlight on India and how India is prepared to deal with a pandemic of this nature, and also how we as government, we as a country prepare. Because I'll reiterate that I don't think there is any plan of action that we saw during the first lockdown, and we're starting the second lockdown tomorrow, and we're given to understand that a plan of action will be revealed tomorrow. So it so appears to us as journalists that first an announcement is made from the podium, and then finally the groundwork is laid. And it should have been the other way around. First the groundwork should have been laid, and then an announcement would have been made.
Yes. So, I mean, I think with all the questions also we're receiving, I will classify them into border pockets, and then I have 3 more issues to cover in this entire thing. Now the important other thing is also the doctors, the frontliners, who are actually fighting this war for us, behalf of all of us. When we're all quarantining or isolating, they're the one who's going out and fighting. The question we all have here is the amount of equipment or the support government is actually giving them. If not for anybody else, did we at least prepare ourselves to support the doctors, to give them enough PPEs? And also there were instances in Andhra Pradesh where, at least as I know in Andhra Pradesh, there were instances where some doctors came out and showed their anger on media and public platforms, including a municipal commissioner and a doctor, and both of them were suspended just because they voiced out that there was no enough actions taken by the government. And then we saw, at least I can say this from Andhra, in Anantapur we saw where 4 doctors, 2 doctors and 2 nurses were tested positive after attending a patient who were not given enough PPEs. Right. So what is this? How do we address this issue of having enough PPEs? And also the question is, when we see all the politicians, going around with good masks and gloves and a pure equipment into public, and they themselves violating the lockdown and actively going on streets. I mean, I can ask this question publicly. Like this, Ram is here. One good thing here I actually respect is, despite being an MP from a very poor state where people expect to show his face, he took a stand and said, like, no, it's not the time, and I'll stay back home. At the cost of politics, I'll stay back home, because that is what a leader does at this times. So, but how do we answer people as public representatives or political parties when we're not giving them enough PPEs to the frontliners, and then we ourselves going out into public, organizing rallies, whatever the other crazy things we're doing? So that's one question I have for all of us, if you can take.
I think half the question is regarding how the politicians should behave in times of these crises, and very well put also, because I've seen there is a big examples going around in Andhra also, maybe in some other places, because there is a huge tendency that whenever these kind of crises happen, the politicians try to take some kind of advantage. There is a motto of service also, but there is another motto of publicity that keeps happening. But there are certain occasions where the politicians themselves have to draw a line, and I personally felt that this is a situation where it is much more serious than going out there and being there or showing your personal presence to the public. It's rather you have to communicate a message that social distancing is much more important than anything. And you always have technology today to interact, to communicate. So I've been doing live sessions to interact with my people and to find out the problems that they have. I've been communicating through them or through the officials on phone. So I definitely disagree with the fact that even the politicians should be on the road, should be visible to the people, or should this, because there are other ways you can address that kind of issue. And the problem is the other side of the problem, where the equipment, where the question about equipment to the doctors, I think that is the utmost priority of the healthcare today, that because they are the frontline workers. If there is any patient, let it be COVID-19 patient or some other disease or anything, so the first person who is going to look after him is the doctor or the medical staff that is present at these hospitals. So the government has to make it a priority in making it available to them. And if that kind of scenario is not happening, and like you said, some VIPs or politicians or some other people who are not relevant have been taking advantage of those kind of situations and abducting these kind of masks or anything, the government should take strict action against them. And that is where the responsibility of the government comes in, where they put in strict measures that if these kind of scenarios happen and there are stringent actions, then it doesn't happen again. And when you try to go along with those kind of situations, and it's just like everyone else is going carefree, and the priorities are all shifted, and even that's what I opposed. I condemned the act of the AP government also, where they suspended the doctor or the bureaucrat who has mentioned that there is not enough masks. And I think that is a reality check for the government. It has to be taken as a suggestion, and they have to be proactive in providing them rather than punishing them for telling the truth. It is the responsibility. It's not something that the opposition can do or something from the NGOs, or they can always help. But the prime responsibility in such a scenario where there is a health emergency, where there is a lockdown, the total responsibility lies with the government. they have to ensure. I've heard there are some manufacturers at certain locations, and especially in Visakhapatnam, there is a medtech zone where they have been catering for the manufacturing of these kind of PPEs or the equipment that is required at this scenario. So the government should make it a responsibility. They have to get the equipment, and they have to make sure that the equipment goes to the medical people, the frontline workers at the first. So not just the doctors, there are sanitation workers at municipal level who are going house to house. And there are some ground level officials who have to travel house to house to ensure proper working of the government schemes and everything. So those are the people that you have to equip them. And until that is done, I think it's a failure on the part of the state government and the central government.
Rakesh, do you have something to add on this?
I mean, I keep going back to information, but unfortunately, because that's the area I work in, at least now I think some state governments have started putting out data on the status of equipment. You know, district-wise, how many PPEs do they have, how many masks, and how many are we? I think the central government is also in their daily press briefing praising people of, you know, what we are doing. I think, like I said, see, every small action gives a lot of confidence to people. So we do hear anecdotal stories about, you know, one particular doctor, one particular hospital not having certain things, and especially when governments are now, you know, making a very controlled environment where they're not allowing private hospitals to deal with patients. I think this should have been, you know, much easier to execute in terms of providing kits to people, because it is not as if every hospital under the tree is taking in patients. It's just, you know, a certain set of hospitals which are designated. So, you know, the requirement, you know, the projections, etc. The first lot to be taken care of are the frontline workers. Forget everybody else. When you and me can wait and you can sit at home, do a homemade mask and sit at home, but the frontline workers are the priority. I mean, at least I hope now the governments have woken up where they're putting out data where people can at least question, you know, if the government is saying there are so many thousands of kits available, some infrastructure available, and if it's not reflected on ground, people can at least question. So earlier there was the questioning, you know, was anecdotal, saying, you know, we didn't have this, but now that there is some information that is being put out by the government saying we are doing this, now we can cross check and you know, and question.
So, shortage of PPEs continues to be one of the major problems with many doctors and healthcare workers right now. Some of them I know personally have been facing it for a while, with each hospital being given only, you know, a very minuscule 5 to 6 PPEs to 20 doctors. And that's the problem of various states, and various states, of course, are taking very proactive measures. But it's not just limited to PPEs. It's also, you know, as I mentioned, there's been a shortage of not just protective gear, there's also been a shortage of you know, testing kits, with rapid testing kits or other form of testing kits that various state governments are trying to independently procure internationally and also from this, you know, central government. So that has been a major problem that we continue to face with. However, having said that, we know that government ICMR has now rolled out tenders, various state governments have rolled out tenders. So we are still not there just as yet. We do not have enough, but I think India is, with each passing day, with, you know, every manufacturer manufacturing it in-house in India, we're still getting there. There is still a shortage, as you know, both my fellow people pointed out, that there is a shortage here, but we are trying to work around it. And each doctor and you know, so this is something, again, a source in one of the hospitals in Himachal Pradesh told me that each doctor is being asked to re-wear, you know, a PPE which is not advised as per standard operating procedure. So there are shortcuts being taken, but we should remember we're putting our frontline workers at risk when we ask them to do that. So it is a need of the hour right now to ensure that we have enough PPEs, that we're able to procure what we've asked countries like China and Japan to deliver to us. There's been a huge lag there because India has not been getting the consignment that it had asked for. So hopefully the government of India will now start building pressure on all these countries to provide them with all the required protective gear that we need.
So, the other side of the question now is also the role of state and the role of center and the coordination between both of it, which I see should be a very important. Also, who takes the decision, who follows the decision as well. Right. So now, in two aspects. One, the funding for states. And now I'm sure all the states are looking towards center for enough economic relief. Well, we'll come down to the economic part, and the last question is my economic part. Right now, my question is also, do we see a sense of true center-state relation happening? Do we really see that happening? Because also one primary question which is coming up is the PM Care Fund versus CMRF Fund. While the Prime Minister Fund gets the eligibility for CSR, while the state doesn't get. So, and there are also other things where the state central decide who gets how many kits, because there's shortage of kits and there's need of rapid testing everywhere, or the PPEs. So, or the procurement from other international organizations or international countries. So, what should you think an ideal where should state and center draw their lines in these kind of scenarios?
I think it's a very tough question to answer, considering the federal structure of this country. There is a rule book. The constitution is there. What comes under the state? What's the business of the center and all that. But in times of these kind of scenarios, I think both the government should have a very open mind. Should be very realistic. Should understand the ground level reality and then act upon it. You can't really build a structure, or you can't really write down a specific rule code where the states and they can draw lines or parallel, because these are very dynamic situations. They're volatile. One step here, the situation changes, and one step there, it might be another scenario. So it is very important that in these kind of scenarios, the governments leave out politics. And that is sometimes visible, but I'm happy to say that it's not much visible at this point of time between the state and center. But that the first understanding is that you have to leave out politics. That is when the beauty of federal structure comes out, is when you leave out the politics and you understand the ground reality and you try to cooperate with each other. And it is convince or get convinced. You have you have a policy where you can advocate what you believe in, or you understand what the other one requests. And when that kind of relationship is there, I think many of the problems that arise, like you say, who needs to do what and this thing. And ultimately, all said and done, the center has a much bigger role, considering the powers it has and considering the way it can direct the states and the way it can implement, the way it can make policies and everything. So what I would suggest in these kind of scenarios, when there is a state or certain sector which is performing extremely well, or there are some activities which are going really good in times of these situations, the center can pick them up. And it can create some kind of advisory where it puts these advisories to the state, saying that you can follow these kind of instructions, or we can provide this much support. Or they can say that, okay, in terms of PPAs, we are trying to procure this much amount. Your state might require this much, so you try to see on your own that maybe establish some clusters in your state. So it's a very proactive kind of relationship that you need to have, and you have to leave out politics, which is easier said than done, because in the Indian political structure, the way things move, they're very, very complicated. Some issue might come up, and like I would take the example of the community thing that happened in Delhi, everything. So sometimes there is a push, there is the outlacing of the political sector also, but that is the things that you have to leave out. So when you leave out the politics aside, then the whole beauty of federal structure comes into place, and the cooperative relationship gets established.
Yeah, thanks, Ram. Coming back, I mean, I'll address the PM Cares versus CMRF first. In fact, in the 2013 Companies Act that was passed by the Parliament, ninth item, in fact, one of the admissible items was any relief fund that is started by a state government. It was also there along with the central government fund. But conspicuously, for some reason, in 2014, it was modified. The entire Schedule 7 was amended, and whatever state government fund was removed from it. I don't know the reason, because we are looking at it in hindsight, but it was actually there in the original Companies Act. It was there. So ideally, if we would have retained that, today even CMRF would have become an admissible activity for CSR. Yeah, coming back to state center, I think we always go back to this, what we learned in school, unity in diversity. So I think this is how crises like this should be handled. All said and done, the center can make policies because it has the fiscal heft, it has the constitutional mandate to do certain things. But at the end of the day, the action and execution happens on ground, and mostly by the states. It is very little by the center. The center can make policies because it has greater infrastructure, access to resources. It can make policies. It should tell people what to do. There has to be that give and take in terms of freedom. Of course, sealing of interstate borders, the center should decide. Travel ban, airlines, the center should decide. Containment plan, what should be the plan? How should we manage the entire thing? The center can decide. But in terms of what can be done at a state level, in terms of containment of hot zones, or what should be open, what should be closed, how can social distancing happen, or how can lockdown can happen, I think states are much better equipped to answer that question at a local level than at a national level, because we don't have one size fits all. We are such a diverse country. So I think that give and take has to happen. And the one question that is on everybody's mind in this country is finances. How are states and center going to finance this whole thing? The states are saying, we have no money left. Some states are talking about, giving, bidding a goodbye to FRBM rules. Let's not worry about fiscal deficit for a while and all that. But at the end of the day, we need to have a plan. State and center, like I said, unity and diversity, there should be uniformity, because it's such a crisis where we need experts, etc. That only center can handle. But at the same time, give enough freedom for the states to handle at a local level. At the end of the day, no state would want to have more cases in their state. Every state would work to minimize the cases at their level. So give that freedom, even for lockdown and other related measures, which tomorrow I am hoping that the center will give that leeway to states for them to decide what can at a state level, what can they decide and what they cannot decide.
So far, this sort of beautiful coordination that we've seen between states and center, and this is very unique. It's a unique problem, and we've seen a very unique sort of a coordination between states and center, barring, of course, West Bengal. There've been a few exchange of letters between the MHA and the West Bengal government. But so far, so good. The only problem is what happens here on. So far, what we've gathered from what various chief ministers have said when they've come out of the meeting with the prime minister is that we agree with the fact that there should be a lockdown. But what happens here on? Because states have incurred huge losses, and as I mentioned earlier, the revenue losses have took a hit by approximately 30 to 40%. That's the national average. So when it comes to kick-starting the economy once again, the onus, of course, will be with the centers. With the center, with the help of various state governments, and how state governments can ensure that they come back on track. So what I see from here on, as far as the future plan of action is concerned, what happens in case of a phased exit plan, because remember the central government has said it very clearly, the Prime Minister today said it, that even in case there's a single case of positive case of coronavirus, from a green zone, we are going to ensure lockdown is implemented in the strictest possible sense. So there is when I see a lot of coordination that will be needed going forward to ensure that while, each state has categorized all its major districts into red zone, green zone, orange zone, there's also a lot of coordination with the center. Enough data is supplied to the central government, and central government can then take actions on whether to seal the borders, etc. or not. Also help in spurring the economic activity, because that's very important right now. The way we see it, it's going to be worse than recession rate as per various global agencies, your IMF, World Bank. So when we come out of this 19-day, the second set of the lockdown, the 19-day lockdown, I think we must ensure that states and center have a better relationship. We don't want, of course, chief ministers to be cribbing about, we don't have enough funds, we were not given enough, help. And these are, of course, various specific states where BJP is not ruling at this point in time. But quite surprisingly, if you take a case of Kerala, and I think Kerala has sort of outdone any other state and has even gone beyond the usual political state-center relationship, and has ensured that it does not even just have enough primary healthcare centers, which it already did due to Nipah and various other problems that the state of Kerala has faced earlier, but also that it has enough PPEs, there's enough testing. It was one of the first states to have drive-in testing, so where you could just go to a booth and you could get yourself tested, unlike any other state so far. So I think Kerala is one role model, and I think various other states should follow the same model. And it's important that states now work independently after the lockdown, as the phased lockdown is over, in order to ensure that it sustains itself, ensures that its population is safe and sound. Because as both my fellow co-panelists pointed out, it is the job, the onus, the responsibility of the states to ensure that its people are safe. And they are the people who are going to ensure that. The local level governance is going to ensure that. Central government cannot ensure that. Central government can only legislate on the matters of where to borrow, how much to borrow, when to seal the borders, etc. But it cannot legislate on how to ensure and implement a proper lockdown, how to help the last standing man, the frontline workers, the healthcare specialists, etc. That's when state governments will have to work proactively.
Yeah. So the last question also, and then there are a couple of Q&As we would like to take. Also, I mean, it's too early to also to talk about what would be the economic impact. We all know it's going to be a bigger one, but we don't know yet, how it's going to shape up, how bad it is going to be, because it's not just dependent on us. It's also the entire Western world and also a lot of other countries, the entire manufacturing, and there are a lot of other things which are coming across the globe as we speak. So what do we? So there's at least one economic relief package announced by the central government for 1.7 lakh crores, and then that's it for now. I mean, every state also said what they're going to do about it. So do you think enough economic plan is happening? Do you see some steps have been taken in the direction at least? Do you see by end of the next second phase of lockdown, at least by the May 3rd or whatever? Do you think the governments would be will be able to assure people of the entire economic or the recession that's gonna probably come? Because all the questions I see, or all the chat is about, also the bigger question the common man today is about what is going to be the economic situation of this country, because I don't think we had this kind of a question in any recent times. So that's the question. Now I also have, as in, what do you think, what do you think in terms of economic government should be doing, or what they're doing, or how do you think we can do better?
See, when you come to this financial package, like you said, the government has already announced one package, but there was no real clarity on how it's going to spend that also. There was an initial announcement of this much, and there were certain sectors that we would give probably 1,000 rupees to some, and farmers are going to be addressed in such a way. Narega probably this much and all that. So that all happened. At that point of time, probably it was okay to start with that kind of package. But now things have little changed. Like you said, even the common man is thinking about the economy more than the health emergency. So the understanding has shifted. The focus of the common man, of the people has shifted. So I think over there, the Prime Minister has missed a great opportunity in kind of giving a confidence through his press conference today, where he could have addressed in little more detail on how he is going to tackle the economy also. Because if you look at some of the countries worldwide, some of the important countries which matter in the world economically, so they've all come to the point where they are addressing the economic situation also. Like you said, is it too early, or do we still need planning? I think the planning should have been done right from day one, because this is the economy is equally important as much as the health. Because a lot of people today are more worried about the economic situation than fearing the COVID-19 situation. So the planning should have started right from day one, and when in these 21 days they should have worked out on what sectors are going to go down, and it's just not planning for just next 15 days of lockdown. I'm saying they should have planned for at least 3 months, 6 months, and 1 year. They should have gone with this idea. And if the 1 month was not coming up with much more clarity, they should have at least done for 3 months or 6 months, and they should have addressed some sectors like service sector or maybe tourism or the travel industry. These are some of the most affected, and this is what we're going to do about them. Some of the industrial sector where there are laborers involved, probably this is what we're going. So the kind of what I really expected from the Prime Minister today was that he's going to dwell a little bit deeper into the economic side of it, rather than just saying that we're going to extend the lockdown because the situation is still like this, so we're going to do this, and the zones and everything. That seemed to be very basic compared to what happened 21 days ago. So that way he really missed a great opportunity in giving that extra bit of confidence to the people. And I think we are late right now, and this has to be immediately addressed. There are a lot of people looking for answers in this specific area, and right now if you talk about any discussion regarding the scenario today, more and more discussion, more and more questions, and more and more clarity seems to be lacking in this specific area, where regarding the stimulus package that is required, how the industry is going to survive, how the economy is going to move forward, how are the restrictions going to be, the tax segment of it, or how is the budget going to be restructured, how is the farmer going to be helped. So these are the questions that have been already put up for quite some time. So they should have addressed it by today. And if not, they are already late. I would say that they should immediately get back onto the blackboard. They should probably get their all the best of the think tanks and best of the bureaucracy, everyone sitting on this and properly planning, and they should take some pointers from the world economy also. They should take some pointers from some of the countries and how they have tackled their own economic situation. Like countries like US, they have announced huge packages, and the way they're dealing with their closed businesses, or the way they're dealing with this whole lockdown situation in this country, I think they can take some pointers from there. So definitely the step has needed to be already taken. If not yet, then definitely right now it has to be done.
Yeah, one is, I think we all agree that we are staring at a very bad economic crisis. I don't think there is disagreement there. But at the same time, like I completely agree with Ram that we need a plan. So US, for instance, has announced a total package of $2 trillion, which is more than 2/3 of our GDP. Current GDP is around 2.9 trillion. So we need a plan, one, to tell what could be the impact of this. When I say what could be the impact, be blunt. If there are job losses, if there are things that we are losing, and secondly, what can be done to kind of convert this entire problem into an opportunity. I mean, every challenge presents an opportunity. Now, people are talking about companies and countries moving their manufacturing bases from China because of all this. But again, all this is conjecture. So I think what needs to be done from the government side is, one, on the economy front, be very clear and forthcoming. What could be the impact? In 3 months from now, 6 months from now, 9 months from now, are we getting into a recession? What is the outlook of GDP outlook for this particular fiscal, in the coming couple of more fiscals, and what will happen to the domestic industry? Each industry wise, what is the outlook? What kind of help will the government give? And unless people get assurances like this, I mean, tomorrow we are staring at a very, 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 very bad situation where we might open everything and we might say on May 4th, Indians lockdown is lifted and we are getting back to our stuff, but there won't be real getting back. A lot of SMEs won't even, a company is not in it by itself. I mean, there is a huge supply chain at every level. There are credit cycles, and now there is disruption at every cycle. So most SMEs won't even open shop because of cash flow issues. So unless we kind of help them out, for example, even the 1.7 crore package, 1.7 lakh crore package, part of it was already there. For instance, the PM Kisan 2000, they just preponed it. And even the GST or income tax, the preponement of dates, etc., is all piecemeal. I don't see any, grand plan of where is the working capital. For anybody to restart work, what you need is capital, 3 months capital. So, for example, the PF rule, which says out of 100, if 90% of your employees earn below 15,000, we'll help you with PF. I mean, how many companies will actually qualify for such a criteria? So I think we need to get realistic. Put working capital in the hands of SMEs. Don't have stringent rules. 3 months, 6 months, get the economy going. Let people start having confidence. Come out, start spending. People won't spend. I mean, you might open malls and theaters tomorrow. Will people go? People won't go unless there is confidence that my job is safe. Unless there is confidence that 3 months from now, 6 months from now, the economy does not look gloomy. I think that has to be done from the government. We can't help if global situation turns in such a way that we are also we are no more an isolated nation. That will anyway happen. But at least whatever is within our hands in terms of our own country, domestic market, I think unless we do that, it is high time, and things have to go hand in hand. You can't wait for the virus to first die and then let's look at the economy. The economy will also die. Things have to be done parallelly. Now this is the time. First half of the lockdown is over. We're getting into the second half. It's high time people talk about on one side the measures we are taking to control the virus, control the pandemic. But equally important is on the other side, let's talk about economy openly. What is going to happen? How are we going to tackle this at every sectoral level? Be as much detailed as possible. Like Ram was saying, for everybody, what is in it for a farmer? What is in it for a student? What is in it, for example, there's so many students just trying to figure out when will they write their entrance exams. When there's the entrance exams, there are lakhs of students, their careers are at stake. So I think every sector, every stakeholder needs clarity now from the government. It's high time both the central and state governments put their heads together and give this clarity.
So yes, of course, clarity is missing. If you ask an average daily middle class person, what exactly do you really care about the economy? I think the only thing that we care about perhaps is 2 square meal a day, and how we're going to ensure that if let's say the company that I'm working in is going to close down tomorrow. Let me give you a quick example of what's happening in the media sector. We have at least 2 to 3 publications, one TV news organization, and one digital publication that is going to lay off about 30% of its staff. And these are some of my fellow journalists with ample experience and really good at what they do. They are staring at a job loss with 1 month severance package, which is to the amount of 1 month's salary. Not enough. They don't have a job. And this is an elite sector, a sector that runs on advertisements and a sector that runs on political funding. Other sectors, other people who are working in different sectors of the society, from your very basic IT to very small companies to MSMEs, etc. How do they finance themselves? Where do they get working capital from? And it's important that we ensure that these people are not laid. People in general, the workforce is not laid off, not by the mere virtue of an advisory that the government put out, kindly don't lay off people, or one of the 7 commandments today by the Prime Minister was, please don't do this to your people, be kind and be nice. Well, kindness is not going to ensure money in hand, and it's obviously not going to run the economy. So that's where the onus lies with the government. Now, we saw an economic package of 1.7 lakh crore when we were actually expecting something to the tune of 10 lakh crore. I mean, the economy is expected to take a hit to about 7 to 8 lakh crore as per experts, as per economists, that we are going to be staring at a loss of 8 to 9 lakh crore, and that's the amount of stimulus we need. And quite interestingly, I was listening to Geeta Gopinath yesterday, and she was the chief economist of IMF, and she said something very interesting. She said it's high time that we stop caring about our fiscal deficit, our debt to GDP ratio, what sort of borrowing we are looking at, because this is an unprecedented situation. Never before in the history of the world have people borrowed to ensure survival. So we're right now borrowing to ensure survival. And right now, I think all your economic parameters, or where do we stand as far as borrowing is concerned, where do we stand in terms of your fiscal deficit is concerned, I think it's about time that that takes a back seat. What should take the gearing, the front seat, and who should be taking the wheels? The Prime Minister should be taking the wheels, and we need to ensure that people they keep their jobs, they get the money that they need, they get 2 square meal a day, they continue to be employed. Your farmers are back in the market, they can harvest, because it's harvesting season now, and we are hoping that the farmers are going to be back to harvest what they've sown, and that produce is put in the market without any hassle. It's also important to ensure that the lock-in strategy that the government is now thinking of, where your migrant workers are going to go back to the industries that they came from, and they're going to be logged in a certain industry and going to ensure working there with adequate measures of social distancing. All these things to spur the engine of growth, the engine of economy, all these measures need to be taken now, because we are staring at not just job losses, we're also staring at millions of people going hungry. If it were not for the state governments and various NGOs who are doing extremely good work, people would have gone hungry, and they're still going hungry as we speak. So there is no policy announcement with respect to that. Perhaps, hopefully, we'll get some clarity tomorrow.
Great. So, I think we covered most of the, and there are a lot of the questions to be covered also, but I think with the time constraint we have, there are 2 interesting questions I would like to take. One is very specific to Ram because it came from one of his constituency. And also another question on the transparency of this one. So YuvaGalam Gattamneni writes, most of the people donated money to PM and CM relief funds. Is there any transparency on this? People are always have this question. So if you have a dashboard at state and national level for the fundraising, why is the government not always ready to show these figures? As in, he's asking if governments can put up a CM and PM relief funds can put up a dashboard on how much they receive and how are they spending at what level.
If you don't mind, can I just add something to that question, Rama? We were discussing something this morning. A lot of us and our family members who are working in state government departments, they are mandatorily cutting 1 day salary. Forest department or other police personnel, they're giving up on their salary. I'm not sure where the money is going, because there is no account of that money. So where exactly is it going? Is it going to the Chief Minister's Relief Fund? Is it going to PM Cares? Some clarity would be nice on where you are taking my 1 day salary and where are you putting it.
Yes, I think this question has been coming up time and again whenever the concept of PMRF or CMRF is under discussion. One of the primary things, and let it be any of the donation or charity that happens, is that is it being spent properly or is it going into the right hands? And again, the responsibility is with the government, and it can very easily be done. These are not figures that need to be hidden. These are not some secretly done things also. They are done for the good of the public, and they are done in these important times. And if you have a very transparent system, it will encourage more people to give on also. And it will create a more smoothful working of these kind of organizations. So it's I think it's come to a time where the PMRF or the CMRF or these kind of I think now the PM has also created PM Cares, which is especially for this COVID, and how that is going to be spent, there is no idea, and it's going. So even our MP lads amount that's been cut. So if that is being cut, where is it going? Which fund is it going into, and how is it being? See, that fund was supposed to come to a parliamentarian to spend in his local constituency. Now my constituency is deficit of those funds. I could have utilized it for the necessary things in terms of COVID itself. I'm very happy to give, but is it going through that way and being spent on the rightful things in my constituency? So these are the questions. Even as a parliamentarian, I also have these questions on this. So it is definitely the government has to come clear on this. They have to make a more transparent system. We have the technology today. We have all the equipment to go to a transparent system. So I would definitely put in a request, probably write a letter to the Prime Minister also, that he has to be more transparent in how the PMRF is being spent.
Yeah, I would second both the opinions. In fact, there were a couple of cases in the High Court where the government argued that they cannot reveal names of institutional donors of the PMNRF, which is which exists now, and there is a conflict between PM Cares and PMNRF. Primarily, so this is being collected to address a pandemic at national level or at a state level, for instance. So there should be utmost transparency. I mean, a lot of small NGOs which collect lakhs of rupees are open about it and are saying, there are, campaigns that are run, crowdfunding, where they're saying, X has donated so much, Y has donated so much. Especially when people in power are, collecting money in the name of addressing calamities. I think it's high time there is utmost transparency here, because people who are donating, whether it's whatever be the amount, 100 rupees or 1,000 rupees or 1 crore, have every right to know how they are being spent. It's high time, the governments are more transparent.
So, Ram, I think you have a direct question from one of your constituency. He says, "Hi, Ramana, this is Manikanda from Palasa. What steps are you taking to ensure the safety of people who are stuck in other states, especially daily wage labor of Srikakulam? And also, what activities are you taking up in Srikakulam to support the people?"
Yeah, I think one of the, like I've said, everyone is kind of dealing with this migration problem. And the way I approached it is with, first of all, I tried to find out how many people are stuck in what kinds of places. And I've tried to use my party cadre system also. There have been people calling different people in the constituency. So I've been in touch with them. So I made a list of all the people who have been stuck as far as I could find out, and I've collected the locations, their phone numbers, and the number of people that are stuck, and I forwarded to the respective governments. If it's Tamil Nadu, I've sent it to the Chief Minister of Tamil Nadu, and I've also coordinated with my own AP government by sending it to the collector. So I've tried to use the bureaucracy system, which is under operation at this point of time, and which is the best possible network available to me. So I've tried to establish a network between the governments here, and the most important request they have been making is that they want to come back to their native place, to the constituency, which is probably very, very difficult in times like lockdown, unless there is an emergency. If there is an emergency, we have been able to work out some kind of letter from the collector or the SP where the allowance for traveling is being given. But rest of the cases, we have tried to provide good food and shelter to the maximum. And there have been repeated cases of people where the food problem has been happening again and again, and we've tried to represent it back to the governments itself. And locally, like I've said, I've been very strictly following the social distancing, and I've been keeping myself at home and engaging with my people in my constituency, or let it be anyone that I have to deal with in terms of phone or through live sessions. I've been taking their questions, or I've been taking their suggestions and all that. And the service, I've been doing some service also in my constituency. I've been providing food to 2,000 people every day who have been stuck in Srikakulam municipality. I've had a team of 4 people, including 2 cooks, who are cooking these meals in a very proper, safe environment, following all the protocols of the social distancing. And they've been packaging these foods, and they've been giving them to the Red Cross, who are taking the responsibility of distributing it along in the constituency to the needful. And also we have started a blood donation camp also, because that's also we have seen that it's a very huge requirement, especially in our district. The sudden droppage in the blood donations have kicked a blood crisis also. So we have gave a call to the youth. I specifically gave a call to the youth, and we are doing 20 people, so that it's not like a huge bunch coming at one time and donating. So we have divided the number of people who wanted to give through days, and we are doing 10 to 15 people every day coming to the Red Cross donating blood. So we're, as much as possible in these difficult times, whatever minimum we can do, I'm trying to do through the charity organization we have, Bhavani Charitable Trust. And rest all, I'm trying to coordinate with the government officials, because they are the ones who are acting upon these things, and it's very difficult. I personally would love to be there. I personally would love to be very engaging on the ground, talking to them, being physically present, but this is not the time. So I once again request my people that rather than trying to just exposing yourself outside, it's better to deal with these kind of things on a more what do you say, maintaining the social distancing and everything. So that try to be little restrictive in terms of meeting people and everything. So I've been trying to do these activities, and whatever best can be done in the future also, I'll try to do my best.
I would like to end this with one last thing. So all of you can give one suggestion. If there's one suggestion that you can give it to your state government or the central government, what do you think should be the one suggestion?
I think probably through the discussion, I've been noting some points, because it has been a very enlightened discussion for me also. I could, such wonderful points have been made by Rakesh and Shweta. I also noted some down. I think one of the most important things today is to get the testing facilities running, and to increase the number of testings that are happening in each and every place, and to do it very aggressively and at random points also. What the governments today are trying to do is they're trying to identify some kind of source, probably has come from Delhi or has come from some other country, and they're trying to segregate these regions and doing them specifically. But I think we are at a stage where we have to do random testing. Kerala has been doing it very, very effectively, and it has to be implemented across the country. I would request my state government also to go to a stage where they're doing the testings have increased, and they're doing it very, very effectively and at random places. So that would give a very clear understanding. Probably it's not the accurate way of doing it, but at least much better than where we are standing, and we give a better picture of the ground reality and how many cases are present and how to deal with it in the coming future. And other than that, I also agree with the point that there has to be a very proactive communication on what the governments are doing, let it be the state or central government, and everything falls in line within this. If it comes to the stimulus package, give a proper understanding. If it comes to the measures in terms of health that are being taken, proper effective communication. So the main consensus I feel here is that a very proactive communication from the governments, giving confidence to the people that this is exactly what we're doing. This is the right information that we want to project. This is what you need to do. This is how you need to cooperate. So this kind of relationship needs to be established between the state governments, central governments with the common man. So that is what I'm looking at from both these governments.
Yeah, coming to me, my 1 point suggestion could be, let's use these 19 days to kind of chart out a plan for the future. I mean, post May 3rd, from May 4th, what are we going to do as a country? Where are we going to? Where are we headed? So let's discuss lock, stock, barrel, all solutions, everything. I think 19 days should be the time, not just for sitting at home and doing following the lockdown and social distancing, but also for governments and citizens to proactively. There is so many technology to proactively communicate to each other and say, this is the plan for May 4th. I mean, come May 4th, this is what so everybody knows the future. It's not as if we are just counting stars and say, what will happen May 4th. I think that will be my single point agenda.
But I'm hoping for more transparency from my state government, And it is possible because there are states which have done that. We have no sort of formal communication. I come from Uttarakhand, and we don't really have an app, or we don't really use technology to tell our people this is where we stand, this is the number today. And so most of us are really dependent on WhatsApp forwards, and they mislead you. They tell you 10 different things which are not true. So I'm hoping that at least my government, which is a BJP ruled government, can come up with a different state-run app like an Arogya Setu at the center, or an app which is being run by the Kerala government, helps you to track down patients who've tested positive, people who've come in contact with them, whether perhaps your next door neighbor has a travel history, or people who are living in the other block have some positive cases. So since lockdown has also been followed by people who've tested positive, suffering from a lot of social stigma and boycott, and many of them have taken their lives. I think it'd be important for us to identify those who have tested positive, and the contact tracing and the route mapping, etc. And so I think there's an absolute dearth of information that exists currently, especially in the Northern Belt, and that needs to be fulfilled. The void needs to be filled by the government, and government of UP, government of Uttarakhand, government of Himachal Pradesh. Perhaps these hill states can do much better in terms of being more transparent, talking to their own people, talking to their own constituents, telling them where we stand, how are we going to go ahead, and how are we going to ensure that we're able to successfully overcome this pandemic. So a knowledge transfer, a transfer of information, better communication perhaps is the need of the hour.
Great. I think, thank you all for your time and all the participants. I mean, I'm sorry that I couldn't give more time for the Q&A. Also because a typical problem is most of them are asking the Andhra politics, and I don't think this panel was for the Andhra politics. Maybe we might have another specific panel on Andhra politics. So I couldn't take a lot of questions from them. With the ending note also, I think one thing I'm more excited to look at, also is how fundamentally the entire functioning of humans are going to change post this pandemic. I think we're much used to this entire new environment of having a Skype calls or business, staying at home, and all of these things.
And I think it's much better, I mean, we're saving on fuel, we're saving on travel, we're not harming the environment anymore by traveling every weekend, one place or the other. I think it's much better.
One bright side to look at.
Yes.
So yeah, thank you all for this wonderful time. I'll also try to take all the feedback from the all the participants. I'll also send it a compiled note to all of you. If there is any specific questions, I would like to mediate between both. And also I'll also connect all the panelists via message or something, so that we can always stay in touch and have more conversations like this. Thank you all. Thank you very much.
Thank you.
My pleasure. Thank you. Thanks, Sravan. Thank you. Thanks, Ram. Thanks, Shweta. Bye.
Yes.